Good afternoon, everyone, and welcome to today's press conference for Friday, the 11th of December 2020. If everyone could please mute on entry from our friends from the press, that would be great. Questions once we've gone through the running order. We are recording today, so we're not going out live. We will record it and upload it as soon as we can once the meeting is finished. So apologies for that, but it should be available pretty quickly after the end of the meeting. So thank you. So today we are going to, the running order will be Whiteman, our Director of Public Health, will go first. Then we'll have Eileen Doyle, who's the Chief Executive Officer for NGH. And then we will have Superintendent Elliot Foskett from Northamptonshire Police. We have a number of other people also here with us that will answer various questions that have been put to us ahead of the meeting. Thank you very much. So I'm going to go straight away to Lucy Whiteman for her surveillance data report as of this week.
Thank you, Councillor Morris. And apologies if it's just me that can hear a lot of background noise. So I wonder if we could just make sure everyone's muted. Alicia, that would be really helpful. So good afternoon, everybody, and thank you as always for coming. Obviously, I'm presenting the latest weekly surveillance report, which includes data up to the 6th of December. So the key messages this week, we've had 981 positive COVID tests in the week up to the 6th of December. Obviously, Northampton specifically, their case rate is higher than the national average and certainly the county average as it stands at the moment. But the majority of transmission continues to be between household members and between households. So again, we're still finding that those messages aren't getting through about how people should be isolating, but also clearly making sure that they're actually adhering to the Tier 2 restrictions. And coronavirus-related hospital admissions and deaths are continuing to be a challenge in the over 60s, and we'll go into a little bit more detail about that in the report. So we've got a couple of pages at the beginning, obviously just with up-to-date information and information on the new media campaigns that we're issuing to support some of these messages. But if we go to slide 6 in the pack, please. So slide 6, just as always, summarises the position. So 15,538 positive cases overall since the pandemic began in our county. And of this number, 981 were reported in the week between the 30th of November and the 6th of December. Obviously, you can see the trend there over time. I've laboured before the fact that after the announcement of the lockdown period, we saw that 54.3% increase in cases. And sadly, all the lockdown therefore did really was allow us to regain the ground that we lost because of that spike and come out pretty much in a similar position to where we went in. So you can see that obviously very clearly playing out there with the just over 1,000 cases in the week prior to the lockdown announcement, that big spike to 1,600 and odd cases in the week of the announcement. And then obviously we're only just back down to just under 1,000 cases now. So it feels like there was a really missed opportunity in relation to lockdown within Northamptonshire. And that does pose some challenges over the next few weeks that we will come on to. If we go on to the next slide, this just gives us a breakdown of the crude case numbers in each of our boroughs and districts. So Northamptonshire overall has increased slightly based on the numbers of the previous week. Thankfully, we are still seeing some effect of lockdown and people's behaviours and reduced transmission, therefore, in the community in Corby, Daventry, East Northants and Kettering. But you can see obviously there that Northampton, South Northampton, Wellingborough's case numbers have actually increased as compared to the previous week. On the next slide, obviously that just provides a pictorial illustration of that. So this obviously shows you the rate of the lab confirmed cases in each of our boroughs and districts as compared to the England and the county average. So that pattern, if we move on to the next slide. I'll keep talking to it. There we go. That pattern, obviously, you can see we've come out the other side of a spike earlier in the sort of period of winter, but you can already start to see that uptick in the rate in Northampton, which is, as we've just mentioned, is now above the national rate, but also you can see upticks there in South Northants and other boroughs and districts. So as I said, it feels like we've missed that opportunity over the lockdown period, and even now in the first couple of days of the data outside of that lockdown period, we're already starting to see an increase in cases. The next slide just gives that as a breakdown in relation to our age groups and genders. So again, we're still seeing that effect in our working age population, but obviously people's eye will be drawn also to the top of that graph, where you can see there's a real increase in the older population, particularly the over 80s female population. So that's our most at-risk groups and our most vulnerable population there that are starting to be exposed to and affected by COVID locally. So a real concern, and I'm sure our acute colleague Eileen will start to talk about what that means in relation to hospital pressures. On the next slide, that just pictorially illustrates some of the messaging I'm talking about with the over 60s. You can see that real fluctuation in cases over the last few weeks. Obviously, the case numbers are smaller than when we look at a whole age population picture. So that's why some of the changes look more marked. But you can see obviously upticks in certain areas there, particularly Northampton and South Northants, as we mentioned earlier, in the case rate in the over 60s. In the next slide, we obviously provide a rate that allows each area to be comparable. And obviously this really does give you an idea of some of the challenges that we're going to be faced with. We've now got only 2 areas that are significantly lower than the county average. The rest are either similar or Northampton being significantly higher as well as compared to the England rate, as we mentioned before. The case rate there is 186.1 cases per 100,000 as a rolling 7-day average. And thankfully, obviously, we're now looking at some of our other areas being just under 100, and we need to be working hard to try and maintain that position in the other boroughs and districts. On the next slide, it just shows you a picture of our current performance around schools, which remains really, really good. Again, positive news around university cases, with only 9 cases being recorded in the last week, up to the 6th of December. But again, 100% of schools open and providing education, a very well needed education to our pupils, allowing them to catch up on some of the gaps that were created in the earlier part of the pandemic. And you can see in the trend in COVID related absences, again, a nice reduction in the trend over time in children, a less marked reduction in trend over time between teaching and teaching assistants, but overall both of those cohort groups going down as a proportion of COVID-related absences, which was really good news. The next few slides obviously provide, as always, that oversight about which boroughs and districts have been most affected in the last 28 days by crude case numbers and also by rates. And slide 15 provides that summary in relation to the change in case rates by different communities, showing where it's going up and where it's going down. If we go on to the next slide, just the summary of outbreaks, this is where actually the lockdown has been sort of most beneficially felt. So 29 current active outbreaks in the county that we're managing. I'm sure people will remember only a few weeks ago it was practically double that. But one of the challenges obviously continues to be those high-risk settings that we talk about at the top of this table. So care homes in some of our areas obviously still continue to find cases through their proactive swabbing process, but you can see there the hospitals and hospices are quite significantly affected again at the moment. Yes, absolutely, in relation to they also want to take that proactive swabbing process, but there are some real challenges in relation to what that means when members of staff are affected and therefore are unavailable to work, but also the fact that areas and wards end up being excluded to new admission. So again, just complicating the picture and adding to that pressure that some of our hospital and care settings are feeling. The next slide gives us a quick summary of the position in relation to flu vaccine uptake. So broadly a good news picture. We have seen an increase in uptake this year compared to last year in most of our age groups, and this is the standard age groups and groups that are eligible for flu vaccination. But sadly, we're still seeing fewer pregnant women come forward than we would want, and it's actually a lesser number than we have seen in previous years. So again, just reinforcing the fact that if you are invited for a flu vaccination, particularly in light of the fact that lots of these people will also be eligible for a COVID vaccination, and there needs to be a window between the two sets of vaccinations, please do keep that appointment. If you feel you're eligible and haven't been invited, then obviously speak to your pharmacist or your GP. But pregnant women and older, ladies and gentlemen, again, please just make sure that you obviously do take up that opportunity as soon as it's offered to you. As usual, at the end, we obviously just summarise the work that we've been doing and the partners that we work with. So if I stop there, that's the summary of the overall data and main messages. Thank you, Councillor Morris.
Thank you very much, Lucy, as always, for that run through of the figures. Some worrying stats in there, although obviously some improvement as well. But we need to keep our eye on what we're doing and make sure that we keep driving down the infection rate. So I'm going to come now to Eileen Doyle, who's the Chief Executive Officer for Northampton General Hospital. Thank you for joining us today, Eileen. I know you're incredibly busy at the moment, so we really do value your time.
Thanks, Councillor Morrison. Hi, everybody. So the figures I've got are for Kettering General and Northampton General. So we sort of measure ourselves together, and it's probably fair to say it's probably been the busiest week that we've had so far this year. As Lucy had mentioned, the rates we're seeing, particularly in Northampton General, have sort of rocketed over the last 2 weeks. And so for NGH at the peak, we had 167 positive inpatient cases at the start of this week. That's gone down slightly, and it looks like it's starting to plateau. But that probably mirrors what Lucy has mentioned around the background incidents in the community. By comparison, KGH, although the numbers are high, so it was 90 this morning, gone down slightly since this morning. They've stayed almost absolutely static over the last week or so. But interestingly, our admissions for other winter diseases and ailments, if you like, have got, the numbers are extraordinary, actually. Probably, so if I give you an example, on average, KGH will admit 70 to 80 patients a day. Yesterday, we admitted 100, and yet our COVID rates are lower. So what we are seeing is not just the background of COVID and the problems that brings, but also the sickness that we see in winter. We're really starting to feel that. So both hospitals are struggling significantly for capacity and have done all week. So we've put lots of plans in place to try and manage that, but it is definitely a challenge. So all in all, together we have 249 COVID inpatients today. So that's 22% of our general bed stock. We have 11 patients between 2 ITUs with COVID. And if you think that we can stretch up to 60 intensive care beds should we need to, actually that number has again stayed very similar all the way through this, actually. So that's a positive. So people are not necessarily getting perhaps as sick as we had worried about, but nevertheless, we wouldn't want it to get any higher. We certainly have, as I said, we've seen NGH saw a big increase in numbers over the last couple of weeks, and that has definitely provided some challenges, because I think, as I've talked before, one of the difficulties is trying to maintain red and green areas so that we're not mixing patients, so that we're not transmitting the disease between those that are on the wards, and so that remains a really big challenge. We've got 2.5% of our near enough 10,000 staff off with COVID positive or COVID related or isolating, waiting for test results. And so actually that's remained okay, but as there is more incidents in the community where our staff largely live, and within households, we are certainly seeing some clusters of staff who unfortunately are picking it up at home and then coming into work and then having to go off. And of course, that's always a challenge, and particularly if you have, it's a challenge when any member of staff goes off sick, but if it happens to be an ED doctor or a social worker or a discharge planner, that becomes a challenge. So we are definitely, I think, both sides struggling a little bit with just trying to cover the gaps, for want of a better phrase. I mean, as Lucy's mentioned, one of the anxieties I think both hospitals have is that our numbers have not gone down sufficiently, and they haven't gone down sufficiently in the community as well, to manage the peak of winter and COVID. And ordinarily this time of the year, and particularly coming up to Christmas week, we do tend to historically empty ourselves out. And I think at the moment we have an anxiety that that's not going to happen for all sorts of reasons, not just COVID, but generally people being unwell. And so that, we think we're going to be in for a couple of really tough weeks. Where ordinarily Christmas Eve is always a glorious day and the hospital's empty. I'm not sure we're going to see it this year. So in terms of messaging for us, it's really, please only come to ED if you need us. Ring 111, get some advice, and see if there are other outlets that you can go and get your care from, because of course the busier we get in terms of numbers of people, the more difficult it is for us to maintain that social distancing, even in an emergency department waiting room. So, you know, we all say it, don't we, hands, face, space, but that is the only thing that really makes sure that we are all keeping ourselves well. And, you know, as I think all on this call have said previously, that, you know, any symptoms, tests are readily available now. Please go and get one. Don't take the chance. We say that to our staff because it's really important. Whereas I think heroically in times past, you'd have struggled in even if you felt terrible. Now we're telling staff to stay at home because it's just, the spread is too great a risk. So it is busy and it is a challenge. And everybody's working flat out, also with our partners, social care and so forth. You know, everybody's trying really, really hard, but it's probably harder than I think we've seen it so far. So fingers crossed that will abate, or at least feel a little bit more under control. In terms of general update on the vaccine, obviously you'll know that NGH have started this week to administer the vaccines, and the packs come in 975s doses, and we've given out 600 first doses up to this morning, and that will continue over the weekend. We've vaccinated about 100 over 80s, and what happens in terms of being invited to a vaccine, because for a vaccine session, is that you will be either contacted by the GP or the national booking system as things develop. It's quite difficult to give detail on what's next and who's next and how that will be rolled out, because it's all moving so quickly. It's almost changing by the hour. But what I can say around Northamptonshire is there are 7 PCN sites, so 7 lots of groups of GPs who are being assessed with a plan to go live next week. But in terms of being able to announce where they are and who they are, I'm not able to do that just yet, but it's moving at a pace, along with 2 further waves of centres, and one would be in the north up towards the Kettering end. And again, that all these centres are being assessed because it's such a precious vaccine. We have to make sure that we're able to administer it properly. And so all of that detail will come out in the coming days. I think that, you know, it's very exciting times. I think that people are really trying hard, and so things are going well. But obviously, in terms of the vast numbers of people that we've got to get through, it's going to take a while, as we've talked about on these previous calls. So please bear with us. You will be contacted. There are 6 care homes who have now been looked at in terms of going first, if you like. And I think Katie, our colleague from Social Services, may be able to give a little bit more detail on this call should she join us. So we're getting there, but it's the start of a big programme of work and a big programme of logistics. So more to come, I think, over coming days, and we will brief people as soon as we're allowed to. I think that's it, actually. Sounds like I'm quite tight.
Eileen, we really do appreciate the updates, and it is a timely reminder of one of the reasons we have the tiers and the control measures is to help protect our NHS and the vulnerable in society, and we're not quite there yet with the vaccine, so we have to keep that going. Otherwise, you know, we're going to see higher infection rates and sadly more deaths, which would be a horrific thing to happen. So we have to try and maintain everything as it is now to protect that. Thank you, Eileen, very much. I'm going to come now to Superintendent Elliot Foskett from Northamptonshire Police. Elliot, good afternoon. Again, I know you're very busy as well, so we really do appreciate your time.
Thank you, Councillor Morris, and good afternoon, everybody. So I'm just going to give you a very brief update and overview on the policing situation in relation to this over the past week or so. So I just wanted to say that we are continuing to keep on the pressure as far as ensuring compliance and enforcement in support of public health colleagues here. We've issued around about 60, I think just short of 60 fixed penalty notices in the past 7 days, and that's around 450 or so since the 24th of September. So I think that paints a really clear picture for you of the seriousness that we in Northamptonshire Police are taking this particular level of compliance. And this includes, I'll give you a flavour of some of these that have over the past week. One in particular is a large party where we've issued a £10,000 fine. And we're likely to see more being issued over the next few days in relation to that incident and a couple of other ones as well, where we're still continuing to investigate the organisers of those events. And we won't shy away from doing that, as I've said in the past. We continue to see gatherings of people not from the same household going around other people's houses. And alarmingly, I guess, for us, given that some of the shops are now open, we've seen a slight increase in the amount of people not wearing face coverings out and about in public, and including people who, when officers have then approached them to say, you need to wear a face covering, they've not given a reasonable excuse and they've failed to do so and continued, and they've been given fines too. We've had issued fines in relation to people not quarantining when they've returned from a relevant country and are required to do so. And we've also, we've seen a reduction, I should say, in the amount of fines issued on public transport, because we're seeing that become less of a problem now. We are still seeing a couple of gatherings outside with people gathering in groups of more than 6, and we're finding where that happens as well, we're issuing fines there. One of the questions I noticed later on, and one that raised its head earlier in the week for us, that was asked of us, is do we see people travelling from other areas into Northamptonshire, from tier 3 areas into Northamptonshire being a tier 2 area? And I can say that from the data we've got, we're not seeing that. You know, that most businesses are adhering to the regulations, and therefore if people do travel, they're socially distanced in any case, so we're not getting to hear about it. And the vast majority of businesses we're finding are being really COVID safe. You know, they're really putting in the restrictions, the limitations that they have to. But where they don't, you know, we will visit with environmental health, and we will take appropriate action. I think I'm just coming on to the Christmas period, which I'll touch on briefly now as well, because I know a couple of questions have been asked around this. You know, Christmas period, again, I said before, we're not the fun police. We do want people to enjoy themselves. It's been a very difficult year for everybody. And, you know, the end is in sight. That doesn't mean to say, however, that, you know, we can just do as we want over that Christmas period. I think Lucy and Eileen made the case really clear as to the kind of precipice that we're facing if we don't keep to the regulations here. So I guess my message to everybody is that we will not be turning a blind eye over the Christmas period. You know, if we know there's going to be some limited mixing of households, that doesn't mean, though, that people can disregard the law. We've still got additional officers in place over the Christmas period, and we will still attend breaches where they're reported to us and continue to enforce the law where it's appropriate to do so. So my message to people is this: don't think that you can have a huge Christmas party putting other people at risk just because it's Christmas, and that we won't respond to it, because we will. And if you are organising a large gathering and it is over 30 people, you are facing a £10,000 fine, and that will hurt, I'm sure. And that's it from me. Thank you, Councillor Morris.
Thank you very much, Elliot, and thank you for all your hard work in the force to help enforce these rules. I've said it many times, this isn't a them and us, we're all in this together, and we have to keep remembering that, don't we? And as you've rightly said, we're in tier 2. People, I think, have started to forget that we're actually still in tier 2 and started to sort of relax a bit for Christmas. And that would be a grave mistake given the information that you've given out, that Lucy's given out, and that Eileen has given out. So we just have to keep the pressure up, and Christmas won't be quite the same as it normally is, but that's how it has to be. So I'm going to open up now to the press. So Laura Coffey, you're first up today. You've been moved up the ranks, Laura. You normally come in at the tail end, but we've moved you up. Good afternoon, Laura. Are you there?
Hello, hi, sorry, just unmuting.
Yes, don't worry.
So my first question is to Lucy Whiteman. So I guess with those, the increase in cases that we've seen, how concerned are you with the as we get closer to Christmas and that 5-day kind of break, as it is, that we're allowed across the country, and in particular, I guess, that rise in cases in Northampton? How concerned are you about that? And I also wanted to ask a question to Eileen Doyle as well. Eileen, you said that you're seeing a lot of patients, not just COVID patients. Are some of these patients, though, linked in with the fact that we've had this pandemic and the fact that some patients, so we've heard from consultants and from the NGH in particular, that they're seeing some patients who have waited because of that first lockdown. So I just wondered whether those are some of the patients that you're now seeing, perhaps that's that kind of backlog because people weren't going to see their GPs and going for hospital appointments before.
Thank you very much, Laura. Good questions as always. I'm going to actually come to Jonathan Nunn on that first one first, about the closeness to Christmas, and then I'll bring possibly Lucy in to comment as well, and then Eileen on your second bit of your question. So it's over to you, Jonathan.
Yeah, thank you, Ian. And look, I suppose I'm really concerned, and just seeing the graph there, so many things, as Lucy said, where we are really, we're at the same level of cases we had end of October when the lockdown was announced. In other words, it's perhaps brought things back down to where they are, but you couldn't call it massive progress, and that's really serious. And maybe some of that's because there's been some aspects of the recent lockdown which have made it a bit more lockdown light than the first lockdown that we went through. More people have been continuing to do their daily business. Perhaps in some ways that's a good thing, but nevertheless, that's about where we are. And you know, vaccine, there's an awful long rollout period and all sorts of potential uncertainties around that, however quickly that can get moving. So I'd say I'm really concerned about this. When you see the sharp kick up that the Northampton graph particularly has taken, we know, and I may be covering ground for a later question, but we know that we get to hear next what happens in terms of tier levels. There's talk of split geographies and not taking whole counties at a time. In Northampton, we need to be really, really careful because our rates are starting to climb again. We cannot assume that we're going to, if you like, kept afloat by the rest of the county, you have better rates. We could see ourselves move to a higher tier because of what's happening specifically in Northampton. With Christmas approaching, it reminds us of a phrase we were using before, which is, you know, even if you can, you have to think about whether you should. We have to be really careful and consider whether we should be taking advantage, if you like, of the relaxed restrictions that Christmas is going to provide, because we're still in real trouble. The case numbers are still incredibly high. I think that's my general thought about the Christmas thing generally.
Thank you very much. Lucy, did you want to add anything to that, or should I go to Eileen for her bit on the second bit of the question? I think I'll come to Eileen. Eileen.
Thanks, Councillor Morris. So, and thanks, Laura. I think that what I would say is that sometimes so I'm sure there are people that would have ordinarily accessed more of their usual care than has been possible over this period since the first wave. You know, we know that, and we know certainly it's not just anecdotal evidence. We know that has happened. I think what I would also say is quite a lot of the patients that we're seeing coming and presenting to us are of a slightly older generation, so my mother's generation. And if I just take my mum as an example, she never bothers the doctor, even when she should. And so then what happens is quite often people try and manage it, and then sort of fall off a cliff edge and end up coming into hospital. So I think that we see that every year. We see that every winter, actually, particularly, especially around some of our older patients. It is just a winter increase, but the difference this time is it's the winter increase with COVID. And so it's not that anybody is inappropriately, well, maybe one or two, but it's not that people are inappropriately attending. I think that people actually are probably trying to manage their own conditions at home a little bit more than perhaps they should, and not asking for help earlier enough. And of course, if you do have a particular underlying condition, or even if you get the flu or pneumonia or whatever it might be, and it takes hold, that's when we start to see people. But it's not just those kind of conditions. Of course, people present with all sorts of things, broken bones, all the usual. So I think it's just the usual winter increase. I couldn't say it's because you know, people are not accessing their usual healthcare provider, but I also think sometimes there's a generational thing that occasionally starts to play in. And of course, we would encourage people to come and see us if they think they need to, or at least come and see somebody. And they will point a GP or 111 or whoever is the healthcare provider will point the patient in the direction to A&E or to the hospital. So this is not unusual. It's just coupled with, you know, something different in play this time, which is COVID, of course.
Thank you very much, Eileen, and thank you for your questions, Laura. I'm coming now to Tom Hitchener from Northants Live. I do feel that Elliot's probably already answered one question there, and Jonathan did you want to come back in, Jonathan?
No, sorry, I was sort of just putting my hand up ready to speak, perhaps on the next question if you wanted me to.
No,
but no, when you're ready, thanks, Ian.
Sorry, so Tom, are you there, Tom? Tom Hitchener.
Yes, I'm here. Thank you. I appreciate that. Yes, I think you are right. Our three prepared questions seem to have been mostly covered. I suppose, I don't know who wants to take this, but we've noticed that the spike in Northampton specific to Cliftonville and Rushmere area, is that something that local people should be worried about? And also, I think Eileen's kind of covered this, but can you give us any indication of maybe how GPs will become involved eventually in the vaccine rollout? yeah, those would be my two ones. As you said, my third one, I think Elliot's covered it, but thank you. I appreciate that.
Thank you, Tom, very much. And yes, I will definitely bring Jonathan in on the Northampton bit, and maybe Eileen could come in on the GP's involvement on the vaccine. So Jonathan, you first. Thank
you. Yeah, thanks very much, Ian, and thanks, Tom. And it was that bit that I was sticking my hand up to want to talk about, really, the sort of Cliftonville, Rushmere area. And part of that is a reassurance, really, quite apart from these press conferences and the briefings here, we have communication throughout the week, and I would like people to be assured that on our own patch, and I'm sure the other council leaders are doing the same thing as well for their areas, we, as elected representatives, have a careful dialogue to understand what's going on within these areas. And so I can tell you I've already sought assurances, and we know that both the local public health in Northamptonshire and public health nationally tracks all COVID hotspots and takes action to make sure it's well managed within the relevant community. We at the Borough Council, we have our own environmental health people as well that focus on these hotspots, working along with the public health folk to make sure that everything is compliant in any areas where there are small outbreaks. We are aware of some small outbreaks within these areas, and that's what causes that. But these are all below the data threshold in which we would not normally name them as specific, because they're not the large outbreaks. There are a number of small ones, but there's so much analysis going on of the test and trace data in any area where there's increasing cases. Should we be worried? It's really hard at the moment with the figures the way they are to say that everybody in Northampton, anything other than everybody in Northampton, should be worried. But in terms of the specifics of these areas, no, there's nothing particular that people in Rushmere and Cliftonville should be particularly worried about. But as a town, as a whole, we should continue to be extremely vigilant. And a little bit of worry fueling that is not a bad thing. So we should all be slightly worried, but there is nothing specific that anybody in either of these particular areas should worry about in particular. There are certain cases, public health and us are aware of them, and action is being taken to make sure that they're confined. Thanks, Ian.
Thank you very much, Jonathan. Yes, worrying times for Northampton, but generally for the whole county as well. The cases are still high across the county, but particularly worrying in Northampton. I'm going to bring in Eileen now, if I may, Eileen, just to talk about how GPs are going to get involved with the vaccination rollout. Thank you, Eileen.
So the GPs across the county and across the country actually will be getting involved as soon as they go through the assessment process. So as I said earlier, there are 7 PCNs across Northampton just in next week's plan. And that will, that's quite a large number of patients, because I think this is what we have to remember. This is the largest, fastest vaccination program this country, in fact, the world has ever tried. And so we need a lot of everybody to try and deliver it. And of course, the thing that's been the rate limiting step around Pfizer vaccine is the ultra low temperature and the amount of times you can move the vaccine before you actually administer it to the patient. So 7 PCNs next week, 2 further waves, including north of the county and Kettering, also being assessed to start within the next 2 weeks. And so we will ramp up the coverage across the entire county, because that's the only way that we'll get the numbers through, and also making sure that we are taking those groups that have been prioritised in swift order. So I'm afraid, I'm sorry, Tom, I'm not unable to give you further detail as to where exactly those PCNs are and what they cover, but that information will come out in the next few days as soon as they've got that approval.
Thank you very much, Eileen, and thank you for your questions, Tom, as always. We're going to come on now to Carly Adele from the Chronicle and Echo. Hi, Carly.
Hi. Mine's for either Lucy or Eileen, if possible, please. I just wanted to ask, I appreciate it may be too soon, but if you've got the kind of uptake percentage of over 80s who have been invited compared to how many people have actually come in for their vaccines, and also what you'd say to anyone who has any kind of doubt or concern about coming to get it done.
Thank you. I mean, Eileen probably can't give you specifics on that, but she could probably talk generally about the messaging around that. Eileen.
So as I said earlier, we've done 90 to 100 patients of the over 80s group just at NGH today, but in terms of numbers that have been invited, I couldn't tell you that figure just yet, but people will be invited. And the way we're currently managing it, of course, is because once the packs are open, the 975 doses are opened, we have to make sure that we have people lined up ready to receive the first vaccine, otherwise it would be wasted, and which would be a tragedy, and we would all think that. So what will happen, Carly, is that either the GPs will call their own patients in, or the national booking system, and everybody will be contacted. So we do ask people not to ring the hospitals, because we couldn't book them even if we wanted to. But those figures will start to come out. In terms of uptake, what I would say is people seem very keen, and our population of over 80s who have been into the hospital to get their vaccine have been very stoical about it, and we've seen some of them on the media and have come in. So I think the uptake is going to be high. In terms of worries, I think there are lots of messages out there, and I think the greatest worry is this has gone through so quickly compared to usual worldwide vaccines. Is it safe? And I think all of that, the regulators and everybody that assesses this have gone through exactly the same process. We've just, I suppose, arguably as a country and as a nation and as a world effort, thrown more at it to get it through more quickly. So, but in terms of the numbers invited, I don't know. But on our current figures, given that we will have invited a very small number of people, they've all come. So I think that's encouraging.
Thank you very much, Eileen. Carly, you had some other written questions there. Did you want to ask any of those questions?
Yeah, there's just one more, if possible, please. Just about the tier, really. Obviously, there's a tier. I know it's central government, but the tier review next week. Do Lucy or Jonathan, for that matter, have kind of any views on whether we will be moving or we'll be staying in the same tier, just because obviously the rate is kind of up there and higher than in London, where there is talk, admittedly not confirmed, but talk of them moving to tier 3. So yeah, just any guidance on the tier, if possible.
Thank you very much, Carly. Yes, Jonathan sort of alluded to that earlier as well, but I mean, it doesn't help to reiterate the importance of what's happening right now. So Jonathan, over to you.
Yeah, thank you, and you're right, really. Andrew, I've sort of given half an answer to that. I don't think we know, but and certainly I've no particular prior knowledge at this stage of tiers or anything. But I just look at those numbers, and Carly's quite right to point out comparisons with London, where there is a lot of talk about them moving up a tier. We almost have to be ready to expect there's a very strong possibility, and certainly, as I say, for us in Northampton, with our trend on the graph having kicked up so dramatically, we really have to be ready for it, and that would be a rotten shame. Everything we do in every day, every single resident, every single business, we've got to be incredibly careful to make sure that we are at least seen to be doing everything. We know it's not a cold, hard, numbers related decision, and we know the hospital occupancy and many other factors. We also hope that where we are seen to be doing everything we possibly can to keep on top of the virus by the precautions that people are taking. When government people come to visit our town, they observe this, and there is some belief that perhaps that has an influence too. So we've got to do everything we possibly can. We've got to be seen to be doing everything we possibly can, because to go into tier 3 would be absolutely awful. But I fear that it's a very, Carly, I fear it's a very real possibility. In terms of the very last part of your question, how will we be informed of changes? We would anticipate getting a very modest amount of advance notice. Previously, because there was a period between the announcement of the lockdown started, we felt there was no need for that. We could be told at the same time as the general public, but on this occasion, I think we will probably get a small amount of advance notice, which we will then communicate to others as soon as we're allowed to. Thanks.
Thank you very much, Jonathan. Lucy, did you want to comment on that at all? No, excellent. I mean, we always like you to comment, of course, but Jonathan covered that very well. You did also ask a question about care homes there, Carly. Did you want to ask that one? Because we do have Katie Brown, the Director of Adult Social Care, on the call, or I can answer part of that as the Adult Social Care lead on the cabinet. Carly.
Hi, thanks. Yeah, so it was just a case of we've spoken to one care home manager who's been part of the first kind of rollout, and I know that Eileen mentioned that there's 6 that are part of that first rollout. We just wondered whether you were able to share the other care homes in the county that are part of that.
Thank you, Carly. I will come to Katie in a minute, but it's worth pointing out that care homes are a high priority group for us, and will remain so throughout this pandemic. So I'm going to bring in Katie Brown, who's our Director of Adult Social Care. Good afternoon, Katie. Thank you for joining us.
Good afternoon, Councillor Morris. I think in the first instance,
Sorry,
we were
Katie,
working
your
to
audio,
vaccinate
sorry,
as many.
your audios are not great. Sorry, Katie.
Sorry. Can you hear me now?
No, it's not great, I'm afraid.
Can you hear me?
Just about. Sorry. Oh, I think we may have lost
Is that any
Katie.
better?
Yep, that's better. Hi, Katie. Sorry.
Okay, sorry, I'll turn my camera off. So in the first instance, we are obviously working to vaccinate as many care home staff as safely as possible, as they are in a high priority group. At this point, it's in the MGH hub that's been set up, and it's not obviously appropriate at this stage to name those care homes, but obviously it's a fast-moving programme to keep pace with the number of vaccines that we have in Northamptonshire. And obviously that programme will progress, as we have heard on the call already, about how we develop that and take that into primary care and then out into the care homes themselves. It's been very successful so far, and we've had good take-up.
Thank you very much, Katie. Sorry about the audio issues there. Apologies, but it was important that we all heard what you had to say. So thank you, Carly, for your questions. Jack Duggan next. Hi, Jack. How are you?
Yeah, good, thank you.
I do feel some of the vaccination questions have probably already been covered. There will be more detail. I think frustrating for everyone, I know, but as soon as there is more detail, I'm sure you'll be the first to get it. So over to you, Jack.
No, that's fine. I understand, and no, I appreciate it. Just I'm sure everyone asking the same questions most of the time. So that's fine. I just wanted to ask Eileen really if about the number of beds that have been taken up in the ITU. I just wonder what happens if you do reach capacity. And just to Lucy as well, you said at the start about lockdown being a bit of a missed opportunity. Do you feel like maybe it was a bit of a waste of time as well doing that? Or you think it could have been better spent otherwise? And what sort of impact do you think that's had on us long term? Really, that'd be great. Thank you.
Thank you, Jack. I'll bring in Eileen first, and then Lucy. Although it might be that Jonathan may want to comment on that last part as well. So I'll bring in Eileen first.
Thanks, Councillor Morris. So, so as I said earlier, we've got 11 COVID intensive care patients with us today, and that number has remained almost identical day on day. So I think this far into the second wave, I would hope that we can probably take a reasonable guess that we are not going to see the level of ITU patients that we've seen previously, and we can stretch to 60 across the county if we need to. We have about the same number in of non-COVID patients, so people that have general things and specific things are wrong with them that need that level of care. And outside of that, Jack, we would go out to the critical care network, because that's how intensive care beds work, that we are part of, Northamptonshire are part of the network across the East Midlands. And that's always been the case for years. And how we manage that is if we have a patient and we have no beds, then we would ask for help from one of our neighbours who may have that capacity. So we would have to, although it's busy and the whole of the East Midlands is busy, we would really have to go some in order to fill up all of those beds. And at the moment, the evidence has suggested, and not least because we know more this time around about how to treat people earlier in the pathway so that they don't get to a level 3 intensive care position with the drugs available, and that seems to be preventing people from the numbers that we saw in the first wave or getting worse. So I think we're reasonably confident that we can manage this.
Thank you, Eileen. That's reassuring. Jonathan, I was just going to bring you in on the sort of views of lockdown, tiers, and all that sort of thing, because I know we all have particular views on that. Jonathan.
Yeah. No. Oh, sorry, because my audio seemed to drop off towards the end of Jack, so I didn't hear the specific bit. General comments about the tier levels, you say?
Yeah, no, it was more to do with the fact that lockdown, it was to Lucy as well, but it was about, did lockdown really work? Was it really worth doing? And the sort of general reflection on the tiers as such.
Yeah, sure. I mean, I suppose, look, if we're blunt, it's not been a marvellous solution that's completely transformed things. As I say, it's brought us back down to where we were just at the start of lockdown, isn't it? That's where we are, and now we've just seen numbers climbing. So you know, in many ways, lockdown works for as long as you lock down, really, doesn't it? As soon as you come out of lockdown, you see that we start to we start to climb again. That's the horrible frustration, really, of that. We're not in such a better place, but that doesn't make it a mistake. In many ways, thank goodness we did do it. If we hadn't, just wonder where those numbers would be, frankly. So overall, it's the right thing to do. I'm glad we've done it. There are people walking around Northampton and Northamptonshire today who have not suffered, but would have suffered if we hadn't had lockdown, because those numbers would be off the chart, wouldn't they? And goodness knows what the position would be in the hospitals. It would be absolutely dreadful. So it was absolutely the right thing to do. It's a shame it's not had a far more transformational impact, but we are where we are. And again, coming back to where does that leave us going forward? Whatever happens on tiers, we know that we've got this 5-day period over Christmas, and that could be absolutely devastating in my view if we don't remain incredibly careful and incredibly vigilant. I'd said a little broadly on the tiers. I think, are we going to end up in tier 3? It's probably not particularly helpful to speculate, but we know we're in trouble where the numbers are going. And we've just got to keep pressing on with all the precautions, as be as careful as we possibly can to avoid tier 3. I don't know if we've got a chance of that. I certainly hope we have. And I know that most people in Northampton are seriously committed to that. So I thank them and ask them to keep those efforts up. Thanks.
Thank you very much, Jonathan. And thank you for the question, Jack. Lucy, did you want to comment?
I do actually, if that's okay, please,
Yes,
Councillor
sure.
Morris. So I think rather than reflect on whether lockdown itself was successful or not, what I'd like us to take just a second to think about actually is what behaviours we saw after the announcement of the lockdown. So in a 4-day period, the behaviours of some, because I know the vast majority are doing the right thing, are trying their very best to not pose a risk to the people that they love and care about and the wider population, but some took the opportunity, despite us still being in tier 1 and so having a rule of 6 in place, to go and do things which caused a 54.3% increase in our cases. So if we had gone into lockdown with around about 1,000 cases, and if you think about the fact that we've halved the cases roughly during lockdown because we've basically got back to where we were before, if people hadn't behaved that way, we would have come out and we would be talking about having less than 500 cases today. And instead, we're talking about having nearly 1,000 still. So if you amplify that over a 5-day period with even more mixing, because, instead of having a rule of 6, you're now allowed to mix with 3 households, you can understand, this is crude maths and imagination, you can understand where we're likely to be at, the beginning of the new year. And I'm sure, one, nobody really wants to be giving someone they love COVID for Christmas, of all things, but 2, of all the discussions we've had about the restrictions, the economic impact, the impact on people's mental health, the impact on our hospital staff and all of our hospital services, we are potentially going to head into a period that is significantly worse than we have seen. And so I think rather than talk about whether the lockdown itself was useful, I think we need to reflect on the missed opportunity there and the impact of people's behaviours in that short period of time, and therefore what could be waiting for us the other side of Christmas if people don't really recognise the risks that the mixing does potentially pose.
Thank you very much. Sobering words, but very, very important words, because Christmas isn't going to be quite the same as it normally is, but it can't be, and we have to assume it won't be, and we have to do it differently this year. 1 year of a slightly reduced Christmas or a slightly lesser Christmas is not, in my view, is not a too big a price to pay to help keep this virus under control in the county. I'm going to see if there's any other questions from the press. I haven't got any hands up. I'm just going to have a look at the chat. No, we don't seem to have any further questions. And I think Lucy's very, very well summed up the position at the end there. So with that in mind, I'm going to probably close the meeting. We're not due, as I understand it now, to meet till the 8th of January again as for a press conference. Is that correct? I'm just looking around to make sure that's correct. Or is it for Lucy? Did you want to answer that? Are we going to have, we're not having one next week, as I understand it, are we?
No, I think we've got one next week. That's our last one though, because I'm sure people don't want to spend Christmas Eve with us, having spent every Friday afternoon with us for weeks now.
Thank you for clarifying that, because I'd written down the 8th of January and I thought that doesn't seem right. So yes, we will be having another meeting next week. Thank you everyone for coming as always. Thank you for the questions from the press. Thank you everyone for their time coming and answering the questions. Let's stay safe, keep to the tier rule, and together we can beat this virus. Have a lovely weekend, everyone. Goodbye.
Thanks,
Thank
Ian.
you, Ian.
Thanks, everybody.